When President Barrow was elected, he came into a healthcare system that was fractured and scattered throughout the country. He made it a priority to begin the important work of expanding infrastructure and making healthcare more accessible and affordable.
The government recognized that there are a lot of challenges when it came to the health sector of this country. The health sector had a lot of challenges. The infrastructure was old, dilapidated in many cases, and access was a problem in many of our regions, in the provinces. We restructured and we enshrined accountability in the health sector. The resources of the health sector must be used for the good of the people.
A lot has changed in terms of our incoming. A lot has changed in terms of infrastructure development. A lot has changed in terms of approach to patient care.
The infrastructure development, it attracts people because people want to come to a conducive and a clean environment that has more privacy because you're talking about delivery, so you need privacy.
We are upgrading labor wards in this country, making them ideal so that each woman will deliver in dignity in a self-contained room to herself with a bathroom and a toilet where after delivery the woman can have shower in her privacy. This is what we are putting in all the health facilities. The labor wards have been transformed. Serekunda Health Center has been transformed in a similar way, and other centers are going to be transformed in that way.
The Gambia is an ever-expanding and growing country. Increasing the number of health facilities around the country will also cut long drives amidst heavy traffic to hospitals and clinics.
Jara kende ala bunda mbe lopitan kutol men lon ani health post ñol ani mina lopitan anol men renovate la atara fo lopitan tallul ñi wato mbe foundation la nga contrat gold dile mbe kudamal men loka.
This government is building 25 new health facilities. 25. 5 have already been completed, some are still ongoing, and some new ones will start very soon.
This is the reason why President Barrow's government has set in motion plans to build a 1,500-bed capacity hospital in Farato, surpassing the capacity of all other hospitals in the country.
One of the highlights of the facilities we are building is the new emergency treatment center for this country. In fact, that's going to be a game changer in the health sector. It is a 103-bed facility that is going to have 20 ICU beds. This is going to be fully equipped with the most modern equipment in the health sector. And that structure, that complex, is also going to have a new public health laboratory, fully equipped. It's also going to have a new national blood transfusion services for the country. And it's also going to have a training and conference center for the Ministry of Health.
Aben nafala bakale mbe tembo mento bifa nga mo dantanki be governor office be training na jela ni yal ko tolle nyanta do kulal ma ko la ka lopitano samba bawo committee le nyanta tarla lopitano e on wo committee le tombonta farato jande fo bi be train ka kabrin wo last week so male nyanta ban lopitano atimo fen kum ma balti bawo duniya kono kufla e wolma nyongo soto londo ani jata kendeya woto ni kino soto da jangu ni non lopitan ba mi yalon ko man tarano ni tundoto ni wonata lonna sare do mo kontan ku parete.
Most of the facilities, like from EFSDH to most of them were built long time, and the culture of maintenance has not been there. So most of them need to be renovated again. So that's why we ended embarking in that project. So EFSDH is being renovated, we are renovating polyclinic, we are renovating 13 other health facilities, we are renovating Basse, we are going to do Buyam, Brikama, Brikama, Sabi. So like many facilities are going to be renovated through different projects, either World Bank or other projects of the government, but we are working on that. We are also building new ones.
Yes, the renovation is important because As a staff, if you have a good, conducive working environment, it enhances your work and improves your performance because you are comfortable at your workplace. And as a patient, if you come to an environment which is well kept, clean, tidy, it gives you the confidence even if before you are attended. And then the patients, with this type of environment, patients are likely to come back, like in an environment that is not clean, not kept. So the renovation work definitely is very important, and we want to tell the government thank you.
You have all seen how we have upgraded and renovated the Ndeban Center, the Edward Francis Small Teaching Hospital at Barrow, how it has been modernized. It has become classical, standard hospital that can take up to 90 or even more patients if the need arises. The new health facilities altogether is going to cost over $250 million.
In addition to expanding the health accessibility, President Barrow launched a model community ambulance service. His government understands that expanding accessibility must also be matched with ensuring there is equipment and the right tools. Under President Barrow, ambulances have been donated to health facilities and hospitals around the country in order to facilitate the quick transport of patients to hospitals.
As I always said, if you are elected president, it is a social contract between you and the population. The contract is to impact on the life of the people, to change the life of the people in a very positive way. And I think these ambulances will go a long way in helping the people in the communities.
We have also known a lot of our people live many kilometers away from the main highways in this country. Getting to the main highways to health facilities can be a nightmare. If a woman goes into labor, for example, at night, without a vehicle in that village, that woman might have to wait until morning for them to struggle to get to the nearest health facility. Or they may use a donkey cart or a horse cart. His Excellency, the President, said, no, this cannot continue. We need to do something about it. And he has brought in 80 community ambulances were bought. The idea of the community ambulances was brought in to this country for the first time by His Excellency. We are building 11 ambulance sites on the same highways, 11. Now these are going to house ambulances that are going to be on standby 24/7, 24 hours, 7 days a week. And the places are going to be occupied by paramedics who are going to be on standby 24 hours, 7 days a week. And if there's an accident on these highways, a unique number will be called, and these paramedics will run to those sites with the ambulances so that the lives of the people who are involved in those ambulances can be saved.
Lopitani bari wuñ time bobu bare ambulance yi tamit bari wuñ dañ doon joge Banjul di dem ci biir Kombo di jëli yeneen patients yi di indi ñu feebar yi time boobu ak bi ak léegi dafa différent léegi lopitaan yi bari nañ ambulance yi bari nañ drivers yi tamit bari nañ.
And by calling a toll-free number, these ambulances will go to the doorsteps of people who need health care, people who have emergency situations, pick them, especially pregnant women, pick them from their homes to a health facility. These are 4x4 Toyota ambulances. I think this is just unique. And we've not seen this in many countries. In Africa, we may be one of the very few countries, if any others are doing this kind of thing. This is just remarkable.
The Barrow government has invested over $350 million worth of equipment in the healthcare sector and expanded access to stable electricity by equipping over 100 facilities with solar panels.
Patient monitors are available, pulse oximeters, thermometers, ultrasound machines. We have brought in X-ray equipment that we've never had before in this country. We have brought in ultrasound machines, 4D color Doppler ultrasound machines that were never available in this country. So the list goes on and on and on. So the government is heavily investing in equipment.
Without those machines, it will be difficult to achieve certain objectives or certain things that you want to achieve towards the management of the patients. Especially nowadays, people who usually experience stomach pain, stomach ache, there are a lot of causes of stomach problem. So you can use the ultrasound scan to use either to diagnose people with enlargement of the liver or problem with the pancreas and some other things. The CT scan is also an advanced machine that one can use to diagnose certain stomach problem or certain problem within the system, alongside with the endoscopy machine that can also be used to diagnose certain GI problems, and some other important machines. So that is why it is always very important to have certain machines on the ground to help us to establish certain problems instead of referring them to overseas or to to Senegal to be able to have a specific diagnosis.
It's cheap. It's relatively cheap because there are people out there who are non-specialists doing this procedure and charging about $5,000 to $6,000. We charge, just to recover the cost, $2,500 is here. If you want to do an endoscopy in Senegal, you pay nothing less than $7,000. If you want to do a colonoscopy in Senegal, you pay nothing less than $12,000. So I think we are keeping the costs down because of the support of the ministry, and we hope that support will continue so that we can expand what we do and do more things.
We have brought in a lot of specialists from friendly countries like Cuba, and we are bringing in more and more specialists to fill in the gaps before our own people are ready to take over someday, inshallah. Yes, there are challenges. We inherited a lot of challenges. Some of the challenges are attitudinal challenges. Attitude. I think we need to address the issue of attitudes. We need to be professional and efficient. We need to go to work on time. And when we are at work, we shouldn't just say we are at work. We should do work, especially healthcare service delivery. We should do work. We should work for the people of this country. Healthcare work is a noble profession. Whatever cadre, it's a noble profession. But the nobility comes from the fact that we take care of people in a respectful way, in a helpful way. We alleviate the suffering of people.
Despite the challenges ahead, the government is ready and well equipped to face them head on.
I think we have to build capacity in this country, and it cannot happen one day. But we have to create an environment so that it will be conducive enough for them to do their courses and also support the health sector.
We are building capacity. So we are training midwives to Bachelor's of Science level. We started a postgraduate training program for doctors, the first time in the history of this country. Also a remarkable achievement of President Barrow's government.
In a developing country like ours, they should embark on specialization in different fields of medicine.
It has always been a necessity. Really, as we all know, people go for specialist treatment across the border to Dakar and elsewhere. So there has always been a need for specialist services. The limitation in terms of numbers of specialists in the country has been the key challenge. And so that's what's being addressed.
Postgraduate training means now the young doctors or any doctor who wishes to specialize can be trained. And that has started in obstetrics and gynecology to take care of the women, pregnant women and women's problems, pediatrics to take care of children, internal medicine to take care of non-operative illnesses of adults, surgery to take care of operations in people, family medicine to take care of the general practice at the polyclinic and various other parts of this country. Currently, postgraduate training is ongoing in these disciplines at the Edward Francis Small Teaching Hospital.
So this program has come in now so that the doctors that wish to specialize in various things could have a career pattern, and they will specialize in their own country, and they would stay here and treat the people of Gambia.
With our new paediatric residents, the training so far is really focused on clinical methods. And in my experience, the training in building the clinical acumen of these very promising young doctors is really second to none. We have a handover meeting every morning starting at 11:30. As you know, there's 3 colleagues here, very senior colleagues from the sub-region who are experts in clinical medicine. And during that handover meeting and during ward rounds and then the residents coming to join us in clinic, they get a really good training in clinical practice.
We have asked the School of Nursing, state-enrolled nurses in Bansang, to increase their intake by 200% this year. We have from 50 individuals to 150 people. We have asked the CHN school, that is the Community Health Nurses School in Mansakonko, to do a similar thing. Increase their intake from 50 to 150 this year so that we train more and more nurses at various levels. Now, with the support of the MRC Holland Foundation, we are building new structures at the Mansakonko School of Community Health Nurses. We are equally building new structures at the State Enrolled Nurses School in Bansang to accommodate and to house more of these trainees. You see the capacity building we are doing. Before now, medical waste, there was no plan for the disposal of medical waste in this country. Medical waste from the hospitals was taken to the common dump sites, and we said no, that shouldn't continue. We have bought 7 huge industrial incinerators for this country, state-of-the-art incinerators. 5 have already arrived. This is a big plus, and these are going to be in the 7 health regions of this country. Each health region is going to get a big incinerator, containerized incinerator. 5 have already arrived to manage medical waste in this country. Introduction of health insurance scheme in the Gambia is a remarkable achievement of the government of His Excellency the President. The health insurance bill has been passed by the National Assembly, and the lawmakers debated and supported the bill, and they unanimously passed the bill. But it is a procedure of the Assembly, National Assembly, that when you go into such an extraordinary session, you withdraw the initial submission and you resubmit at the same session again. So we are very optimistic, and with this government, inshallah, the healthcare service sector of this country will become the best in Africa. We are that optimistic.
Under the continued presidency of Barrow, Gambians can feel confident that accessibility will expand, facilities will improve, equipment will be invested in, and Gambians will have healthcare they deserve to have.
Manso manso likono, ala baro na da dokula, ni mantera wo nganyila.